from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back, everybody. 6:23 is the time. If you've been told you're in need of a knee replacement, Baptist Health is the first and only Central Arkansas hospital to offer a robotic arm-assisted knee replacement with Stryker's Mako system. So what does this mean for you as a patient? Joining us this morning to talk about it is Baptist Health orthopedic surgeon Dr. Joel Smith to explain. Dr. Smith, thanks for being here bright and early with us.
Thanks for having us.
This is obviously exciting for you guys having this type of technology. So how does this work, and what are some of the things that you see as benefits already?
Well, with the Mako system, we can provide each patient with a very unique, personalized model for their knee and surgical experience based upon a CT scan that allows us to create a preoperative plan before we ever enter the operating room that gives us the patient's specific anatomy that we can determine the size of the implant, the orientation, the alignment, which are all things that you could do in the past, but not with such precision now. And it now allows us to, the really unique part of it is that in the past you kind of had to rely on feel, which is great. We can still do that, but now we have real-time numbers looking at a computer and a robot that tells us, okay, well, this patient's knee is too tight in this degree of flexion or extension, and we can make real-time adjustments based upon those numbers, where in the past you kind of just had to kind of look at it and guess, and
Sure.
now we can see exact numbers, and gives you a much more reliable experience for the surgeon and the patient, that when they leave the operating room, you know they're going to leave with a great product.
What are some of the symptoms for people who are at home that might be experiencing some kind of knee pain that would make them eligible for some type of surgery?
Well, anybody that's been told that they need a knee replacement or that they have arthritis would be someone that would be in a candidate for that type of surgery. So, you know, most of those type of symptoms are joint-related pain, swelling in the knee, pain, particularly that as the day goes on gets worse. Pain that starts to limit your ability to kneel, squat, go up and down stairs, things like that.
Average everyday things, not exercise or anything like that, really. We're just talking, you know, walking up and down stairs.
Yes,
getting video now of the robot and how you guys utilize it. So tell us a little about what this video is showing us and how you guys actually utilize this in a surgical procedure.
A lot of what that video is showing happens before we ever get in the operating room. We have very specialized assistants that help register the patients or make sure the robot is working perfectly. We already have the preoperative plan based, and then so once everything is done with the checkpoints, then we take what they're showing right now is that we take a probe and we basically verify where the robot thinks that we're placing the probe, and so that way we're all on the same page between the robot and the surgeon, and that then allows us to make the cuts where we need to make them based upon where the patient's CT scan determined it and where we feel like in real time we are based upon that patient's anatomy.
Pretty impressive. Okay, so an opportunity for people to call in tonight and ask more questions?
So this evening you can call in, 324-HELP is the number. There will be a host of surgeons this evening that will be able to answer your questions, and the Baptist Helpline can help you if you need to get in to see a doctor that does this type of surgery. All
right, fantastic. 1-888-BAPTIST, and 5 to 6:30 p.m., by the way, tonight is that call. And if you have any questions about this Mako system, it is the first and only robotic assisted surgical system here in Central Arkansas at the local hospitals, and it's at Baptist Health where they help you keep on amazing. Dr. Smith, thanks for coming in this morning.
Thanks for having us.
And thanks for all the work that you guys do, and on hand to answer questions later tonight for you. So make sure you call in.